Well, Sitaram, and a pleasant good morning to all of our viewers and listeners, and welcome to another edition of the program Addiction and Recovery. I am your moderator this morning, Jason Glue. Join me as we welcome the host to the program Addiction and Recovery, Mr. Ramnes Dwarka.
Thank you very much, Jason. And let me join with you in welcoming all our listeners, both in Trinidad and Tobago and worldwide on the various media platforms to this program, and to let our listeners know, those of you who miss it live at this point in time, you can also go back, and the program is rerun again at 10 p.m. tonight, and it will be posted on YouTube as well as on the other social media platforms, so you can view it and listen to it at your own leisure. So I want to again thank the television station and the team, yourself, Jason, and Francis, and all the people in the back there who source these beautiful and very inspiring videos that precede the program. And I also like to let our listeners know this is an interactive program. If you have questions, you can call in and we will try to address them and as best as possible. You know, we have been talking about substance abuse and drug addiction. And when we talk about drug addiction, we tend to, it comes up in our mind that, we're only talking about those drugs that are illicit drugs, and those that cause so much obvious trouble. And sometimes we miss quite a large amount of other drugs that are being used, prescription pills and all of that. And we seem to think that, they don't cause any problem. So today I want to speak about the difficulties, some of the difficulties when one is attempting to come off these drugs. Now, let me say at the outset, I am not a medical doctor, but I am an acupuncturist, and I have worked extensively in the field of substance abuse and recovery, personal recovery myself, and I practice complementary medicine. I do have a lot of people, even medical professionals, who I have helped in the past to come off prescription pills as well. Jason, when we think about addiction, we think about cocaine and marijuana and the illicit drugs and to some extent alcohol. But alcoholics don't see themselves as bad as the marijuana addicts and the cocaine addicts and the heroin addicts. In Trinidad, there's a slang, we call them pipers. Because of the kind of activities they sometimes have to resort to supply their habit. Some of them, they have to steal, they commit crimes to support the habit. And the women sometimes engage in prostitution just so that they can get their fix, purchase their drugs. But I also want to alert our brothers and sisters listening out there that people can become addicted to not only substances, they can become addicted to behaviors as well. So now we have recognized there's such a thing as sexual addiction. There are people who are addicted to certain behaviors like gambling. You can become addicted to gambling as well, although it's not a substance. So I would ask that we keep an open mind, because it is not only restricted to alcohol use or marijuana use or cocaine, but also to behaviors. And the same principles, the same techniques that we employ to come off the illicit drugs and the alcohol and all of that are similar to the same principles that we'll have to apply if we want to get off the behavior addiction, the gambling and all of that. There are people who are addicted to foods as well and suffer with obesity. So that the same principles can work for those as well as it can be used to come off drugs that have been prescribed for us, but we have become dependent on them and addicted to them. And as a result of our dependence on these psychotropic drugs, as they are often referred to, we can now start having severe problems. And especially this morning, I want to speak about withdrawal symptoms. Because once you have been using a drug for a long time, and in this case, I mean not only illicit drugs, any drug, any mood-altering substance, any psychoactive drug, when we stop using them, the body can go into withdrawal. And I'm just going to cite some of the withdrawal symptoms just for these sleeping pills, as we call them, the tranquilizers and sleeping pills. And the withdrawal symptoms can include insomnia. Insomnia is that problem to drop asleep and to stay asleep, to have a proper sleep for the night, insomnia. It can also cause anxiety. People who stop using drugs, mood-altering substances, when they stop after they've been using it for a long time, they can suffer with anxiety, panic attacks, muscle pain, depression. And as I say that, I've realized that a lot of people who continue to use alcohol and the marijuana and some of the prescription pills, they now are using these, as we say in rehabilitation circles, they're self-medicating. They're using these substances to actually help them to deal with the depression or the anxiety. And I did make reference to this in a previous program, where a lot of people are now, they're on prescription pills, sedatives, tranquilizers, and when it is not delivering because they have developed tolerance and they are not getting the effect, they are not being able to sleep, or they're still, in spite of taking what was prescribed, they're still feeling depressed or anxious, some of them are now supplementing it with other psychoactive drugs, illicit substances, and sometimes they use alcohol to help them to cope or to deal with anxiety or to deal with depression. And I am saying this because people like myself, professionals in the field, they need to understand these. Family members need to understand this, because they may not see their loved one taking a drink or two as being a problem. But if that relative is on psychiatric drugs, it is taking alcohol or other psychoactive substances, marijuana and so on, can cause an overdose, can exacerbate their problem. And it would mean that they have voluntarily decided to increase their dosage of psychoactive substances, so that for them to stop becomes even more difficult. And I've had quite a number of upper middle class people who started off going to see their psychiatrist, being put on psychoactive drugs to help them to deal with anxiety or depression, insomnia, and you name it. And then, because they are social creatures, they go to so many parties, they are also now using alcohol and other substances, marijuana and all of that, in addition to the prescription pills. And that produces it is dangerous, because the people who produce the medicines, the sedatives and all of that, they never tested it on people who were using alcohol and other substances. And you know, if you're using medication and you use another medication, even if it's prescribed, you need to let your doctor know, because sometimes it is contraindicated. One medicine can react with another one to cause severe harm and can even be fatal. And I know in the old days, some people would be told, look, if you're taking doctor medicine, you can't take alcohol because it can kill you. And so for the same reasoning, a lot of people who are on medication, whether it be for physical complaints, and they're taking alcohol and marijuana and other psychoactive drugs, they are putting themselves at risk, because you can overdose yourself, and then instead of you putting your brain to sleep, you can put your heart to sleep. And if your heart drop asleep decent, you will not wake up unless you have to go to a trauma center and so on. So again, just to list some of these withdrawal symptoms, as I said, insomnia, anxiety, panic attacks, muscle pain, depression. And then some people who have been using it for a long time, alcohol included, can start having what is called delirium tremens, which means you are going to be seeing and hearing things that are not there. Sometimes some people have described these hallucinations, these visual hallucinations, as actually enjoyable because, they see people dancing and all of that. But most of the people I have experienced, it provokes their worst fears. They see animals coming to attack them. They see people coming out to attack them. They actually see the person in the television trying to shoot them instead of shoot the villain. It's a very scary thing. I've actually seen people jump out of moving vehicles because they went into withdrawal and were experiencing delirium tremens. And a lot of people can suffer with cardiac arrest because it's a very frightening experience. So some people experience dizziness and an abnormal sensitivity to noise, touch, and smell. Some people feel a sense of weakness and heart palpitations. Some people experience a dry mouth and a feeling of having an enlarged tongue. There is also the sensation that you have a tightening band around your head. Some of the symptoms seem to be minor ones, but they are nevertheless rather strange. Some people have a metallic taste in their mouth or experience the feeling that buildings are going to fall on them or that the ground under their feet is not solid and their muscles may twitch uncontrollably. Now, if this sounds a horrifying list of symptoms, take heart, most people only suffer from 3 or 4 of them. The problem is that the withdrawal symptoms can confuse you into thinking the old anxiety for which you were originally prescribed the pills is back again. It isn't, though the symptoms can last for several weeks, even months if you have been on tablets for years and years. All the anxiety, the confusion of withdrawal will settle down eventually. Now, I know a lot of people feel scared, but these withdrawal symptoms that I've just read can be found true for not only alcohol, sedatives, but most psychoactive substances. There's a saying, you can't have a hill without a valley. So whatever gets you high, there's a price to pay for that when you're coming down. Whatever goes up must come down, including your brain. And so what a lot of people are doing, they're taking stimulants in addition to sedatives so that they won't go too high, so that when they come down, they wouldn't go too low. But it's like, you're holding your brain and stretching it in 2 different directions. Actually, the drug is literally destroying the brain cells when people mix drugs like this. So one of the popular ones, I'm just going to deal with one of them today, and that is insomnia. A lot of people I have found in my practice I have been helping people for the last almost 30 years to get off psychoactive substances, not only the alcohol and the marijuana and the cocaine, but I've also had to even more work with people who are on prescription pill medication. Now, I would want to say at the outset, it is not ethical, and I will not advise someone to stop using their prescription medication, especially psychoactive substances, the sleeping pills, and all of that, because to stop using these things abruptly can be very dangerous. You can go into so severe withdrawal that like I said, you can have cardiac arrest and things like that if you're an advanced age. So usually, if you have been using sleeping pills, you need to come off them gradually. There's actually a formula. Now, normally, a person may be able to come off these within 4 to 6 weeks. Once they have the desire to, it can be done in conjunction with counseling and weaning yourself off the drug. There's a protocol how to wean a person off that doctors are familiar with. In my practice here, I have been able to use acupuncture, auricular acupuncture, that I've discussed in a previous program, to successfully wean people off all psychoactive substances. In fact, the acupuncture substantially helps the person to be able to deal with the withdrawal symptoms. They become much more mild. Again, I don't suggest that people stop immediately and suddenly, but with acupuncture, it hastens the process. And the definite advantage is that you cannot become addicted to acupuncture because it doesn't give you a high. It prevents you from becoming anxious, and it also prevents you from becoming depressed. But in the meantime, with the counseling session, the person is actually counseled into how they can now be able to cope with whatever was producing the anxiety in the original case, or what may have precipitated the depression, the psychological factors. They are counseled into learning new coping skills, how to deal with those things. But this morning, I want to especially, this is my gift to our listeners this morning, I want to do what is called sleep therapy. Because there's a lot of people who are not even have abused substances. For ordinary, normal reasons, they're having difficulty to sleep. And let me start off from the outset. You know, I have also found, Jason, in my practice here, a lot of people are unaware as to what is normal sleep. A lot of people believe that if they can't sleep as long as they would like to, there's a problem. Especially there are people who work during the week and who think that, look, on Saturday night or Sunday, I should be able to sleep all day, right? Well, the body doesn't work like that. There's a sort of sleep is a developmental process. And there are different stages to sleep that I'll speak about. You'll notice when we were infants, when we were just born, as a baby, in the first week or two, we were sleeping like almost 20 hours, 22 hours, because we were just waking up to eat and go back to sleep. And it is because our bodies were growing at the time. And then later on, as children, infants and so on, growing up, every sleep is different for every human being. And this is why these are just broad guidelines, but you would find as young children, yes, we could sleep 12 to 14 hours because we are still growing. And sleep is important because it is in sleep that we repair the body, we regenerate, we also process all the life experiences we had during the day. And we sort out, it's like we go through all our experiences and we file them away in our memories, what we will need to remember, what we don't need to remember, what we did not understand well, what we had trouble coping with, what caused stress and frustration or fear and guilt. All of those things are happening in the night while we are asleep. So that sleep in itself could be divided into, there are basically 4 stages, but 2 basic stages, that is delta sleep and REM sleep. Delta sleep is like the first 90 minutes where we go into such a deep sleep. Our ears drop asleep. That is, we are not even aware of what is happening around us. And that is a very, very important sleep. That is when all the muscles and everything is relaxed. And then we go into what is called REM sleep. That is rapid eye movement, REM. Where in REM sleep, we are dreaming, and that is when you see people's hand and feet and body twitching and all of that. Because sometimes we are actually acting out in our dreams. Our bodies are moving. And sometimes I think dogs also have REM sleep because you see their feet moving when you're asleep, And it is very, very important. And I'm saying that because when we drink or we use drugs, we induce an artificial kind of sleep that does not allow for these processes to take place properly. So even though we took the sleeping pills and we thought we were asleep all night, what happens the next day when we get up, we feel like, boy, we're tired. We feel very weak. You understand? It's like somebody tied us down to the bed and we struggled all night to get up. And that is basically what happens when we take artificial drugs, when we take these sleeping pills and all of that. The body is struggling to neutralize that pill all night. So next day we wake up, our eyes dry, our mouth dry, or we feel like somebody beat us up. And so we don't rest properly. And when you've been using it for years and years, it can have an impact on your health. So that these psychotropic drugs, sleeping pills and tranquilizers, were originally intended to give people to only tide them off over a particular situation, like someone who just lost a very close relative, a confidant, going through divorce, estrangement, or having to deal with a lot of painful, because of an accident, pain and all of that, and having trouble to sleep, might be prescribed these sleep aids, but it should always be only for a short period. And I think most doctors advise their clients that, look, this could become habit forming or addictive, and that I'm only going to give you it for a week or two, and then you will have to come off these drugs. Unfortunately, a lot of us Trinidadians, and not only in Trinidad, let me not blame our own people, but worldwide, a lot of people, they read the name of the label, they realize this is helping them to sleep. And so they go to the pharmacy and they find a way to get it under the counter somehow. And they now become dependent. And at first, 2 milligrams would have put them to sleep. But now, after a little while, the situation persists. They are becoming a dependent. Their body is developing tolerance. And so gradually they go to 5, 10, 15, and you know the story. If you time lapse the whole thing, you'll see over years, they'll have to, now sometimes that drug is no longer able to put you to sleep. You have to get something stronger. And so the story continues. And eventually you are now, well, some people will describe you as bipolar. When you're not on your pills, you're in the dumps. And when you're on the pills, you're high like a kite. You understand? So you're hardly ever normal. So then people around you, they've never seen Jason as Jason used to be. Who is this new Jason? You follow? Because you are very often, in either in an ecstatic state, an overactive state, or sometimes you're in the dumps, or you're depressed, or irritable. These are some of the withdrawal symptoms. So you don't really get to see the person. So people in my profession, we advise, if you have a person in front of you, sitting in front of you, who is under the influence of any psychotropic drug, if you're really going to get a proper history from that person, be able to make a proper analysis, you need to see them sober. So as a rule, if someone came to my office drunk, I will not turn them away, but I bear it in mind that maybe I'm not really speaking to that person at all. I will probably speak to them, but ask them to come back a day and insist when they come to me, they are sober. So let's deal with the insomnia. If for any reason, because of some situation you are going through in your life right now, some stress, and this can go even children, with all this SEA and CXC and all of that, they are poor things, stressed out, and it can interfere with their sleep pattern. But you have a whole lot of all those people who are shift workers, Jason, like yourself included, sometimes, because we have what is called a biological clock that we have developed over time. And we, like, for instance, every one of us would have developed a routine so that around about 8:30, 9, generally 10 o'clock, I'm speaking about myself, about 9, I would start feeling sleepy. And if I go to sleep, I'll get a good night's rest and I'll be able to function normally the next day. I would not feel sleepy during the day and all of that. But if I was not able to sleep at 9 and I postponed it, then what happens is, in trying to fight off the sleep, my body will produce adrenaline, which is just like taking a strong shot of coffee, a stimulant. And then I may not be able to produce the sedative element to put me to sleep unless I wait another 4 hours. You'll find all the way into 12, 1 o'clock now, I'm still awake and now feeling asleep. And when I sleep at that time, then if I had to get up to go to work at 5:30 to start preparing to go to work, the alarm clock will wake me up. But then during the day, I will feel sleepy. And what happens over time, because of that, my whole biological clock, as it were, will get disturbed. And now I will have trouble to sleep. I will not be able to sleep when I'm supposed to, get up when I'm supposed to. I'll be feeling sleepy when I'm supposed to be at work and alert. And these things in the long run, it has a lot of other psychological issues that it can cause. It can cause me not to be able to be focused. I can become very irritable. I can have difficulty solving simple problems. I can have problems with my memory. It can interfere with my immune system as well. If I'm not resting properly, it will interfere with my whole body chemistry in terms of repair and regeneration and recreation and all of those things. So sleep, this is why sleep is said to be golden. I know people, we have had the examples of people who were sleep deprived because of their lifestyle. And, I could think of this rock star, I don't recall his name right now. The one who did the moonwalking and all of that. You remember him? Who had to be taking all of these medication, and eventually his doctor, who's a Trinidadian, was arrested for it. So that someone who can't sleep will tell you how, debilitating it is. And sleep is not only a function of giving the body rest so that it can repair. It is also a way of getting relief from the day-to-day problems. And this is why you'd find a lot of people who are depressed, who are going through difficult periods. They wish they could just go to sleep for a long period, and when they wake up, that everything would have resolved itself and changed. And especially those who have lost a loved one. For a long time, they remain in denial and believing, no, this is just a dream. This is not happening, and hoping that they'll one day go to sleep and wake up out of this dream and the other person will be there. You understand? So I'm just emphasizing how important sleep is. So all our listeners out there who are having difficulty to sleep, few things you need to do seriously is to establish and maintain your biological clock. For whatever reason, try to set a time to sleep and make sure you stick with it. No matter how interesting the TV program is or whatever other activity, when you're feeling sleepy, you should go to sleep. And as I started out by saying, a lot of people are unaware of how many hours they're supposed to sleep. They still think that at my age, I should still be getting 12 and 15 hours sleep. No. As we grow older, we need less sleep. So basically, the most essential, important sleep is the first 90 minutes, The rest, I like to say, like we say in Trinidad, is lie-up, is extras. You can manage without it, although you'd be better off if you had it. So that I would say for a grown adult, 6 to 7 hours is sufficient sleep. You understand? And then that too will vary. There are some people who could sleep for just an hour and a half and they can manage. There are people who have trained themselves, like people in medical profession, doctors, they power nap and they are fresh and up and ready to do their surgery and do things again. Then the people in the military, they learn out of habit because of their profession to sleep very lightly. because if they slept heavy, they probably will not survive the war. And then there are those of us who are so peaceful and relaxed that, man, you could put a mic near our ears, we would still sleep. You understand? And I'm one of those. I'm so happy because when I go to sleep without a care, you know? And then again, as I say that, there are a lot of people who, because of other health problems, diabetes and all of that, they have to wake up in the night to use the washroom. And when they wake up in the night, they have trouble to go back to sleep because, during the day, Jason, we can distract ourselves with a lot of things, with the activities of the day. We can distract ourselves. But when we wake up in the night, go use the washroom and come back, everybody's asleep. And now we have nothing to distract us. And those stubborn issues that we were able to push into the background during the day, they come up in the mind for resolution. And if you're a person like we are sometimes, we are people who, we're not dukedam, as we say in Trinidad. We are very conscious about our health, our relationships, our finances, our career, so that these issues, when they come up, we struggle with them into the morning sometimes, trying to find resolution before we could go to sleep. And these would be the things that keep us awake. And we keep fighting with ourselves. Oh gosh, tomorrow I'll be a mess if I don't get sleep because I have a hard day tomorrow. And this thing, and let me say this, it might sound comical, but the cure for insomnia, Jason, the cure for insomnia is that you shouldn't lose any sleep over it. Meaning, you shouldn't worry over it. And once you start worrying over it, you will not be able to sleep because your body will secrete adrenaline. So let's go back. Quickly, I want to give some hints because the time flies when we are talking about these things. First thing is, please don't drink too much liquids late into the evening because common sense will tell you it will wake you up in the night. And when you wake up and you have already had your delta sleep, you may have a little problem to get the REM sleep. Secondly is I want everyone to listen now. I don't know if anyone have ever seen a death certificate where the cause of death was lack of sleep. I've never seen that. In other words, I'm saying to you, if you don't sleep, you're not going to die. So stop worrying about it. Once you stop worrying about it, you are going to go to sleep. Thirdly is please make your room sleep conducive. The room you don't want mosquitoes buzzing around your ears in the night. And if your room is hot and sweaty and clammy and all of that, then you have trouble to sleep. Use a net. It's better than using these cockshuts and things like that. It's not healthy. I think a net is a very useful thing. It gives you the assurance that you don't have to worry where the mosquito is going to bite you or if they're going to bite you. You feel secured in the net. I sleep with a net. And make sure that the room is cool and well ventilated. Then again, if you have a partner in the room who snores, well, you may do well to go and drop asleep before them. You understand? Or if you're having trouble, you may want to sleep in a more conducive room to reestablish your biological clock and sleep pattern. Again, please, your bedroom is for sleeping. A lot of people use their bedroom as their recreation room, as their office, and all of that. The mind associates a place with an activity. To illustrate that, I just want to use the toilet as an example. You'll walk the whole Port of Spain and all about, and you'll never do a number. But as soon as you go and sit in that little cubicle, and there it happens, because the mind knows that's the place for that. So too, the mind must associate bedroom with sleep. So as soon as you go and hit the sack, you go to sleep. But a lot of us, we have our televisions in there, and we have our computer, and we have and one of the worst things that is happening now, we're going onto these social media platforms on our cell phone in bed, and then we keep scrolling from one frame to the other frame, and then we're feeling sleepy, but we want to see where was flooded, and we want to see the bacchanal that happened in the politics, and you know it, Jason, and then sleep time has gone, and we don't have the discipline when we're yawning to go to sleep, to put down the phone, and it is destroying our sleep pattern. So please do yourself a favor, put down the phone. Now, what I've also found very useful is you should glance at the time. Okay, you read your papers, you watch your movie. It is good to relax for about an hour. If you just run off the street, you just can't jump into bed and drop asleep. It's good to sit down and relax, read, watch your TV, listen to music for about an hour. And when you feel sleepy, notwithstanding whatever happening, then go in your bed and lie down. Don't go in your bed and lie down and wait to feel sleepy. Because if you suffer with insomnia, in 5 minutes, you'll start thinking, oh gosh, it's one of those nights again, and I will not be able to sleep. And then your mind is running relays. Tomorrow, this would happen and all of that. And once you get into that mode, you will not be able to sleep. So sit, read your TV, read your papers, read your books, whatever, watch your TV. And when you feel sleepy, put it down, switch it off, go to sleep. Now, those who have this discipline to switch off the TV in the bedroom, you can have your TV in the bedroom, because I do have a TV in my bedroom. You understand? And I have this sense to just take it off and go to sleep. Now, it is also very useful to have a clock that you can glance at, whether you look at it on your phone or on a wall clock or a reflective clock, so you get an idea at about what time you went to sleep. Because most people, when they wake up in the night, they are disoriented in terms of time and place and all of that. And there's always the feeling, look, I just went to sleep, and look, I'm up and everybody's asleep, and you start getting anxious again. But if you look at the clock and you saw you got your first hour and a half, and you remember what I said, that you already got your delta sleep, and you know that, look, you are going to be all right because you got your essential sleep, and now it's just the REM sleep. That whole idea is not so that you don't get anxious and that you could go back to sleep. Now, you wake up to use the washroom, okay, you went back. It again, if your washroom is a quarter mile away from your bed, then you're going to have a problem making the journey. I know a lot of people get up and have to go to the outhouse and all kind of thing, and by the time you come back to bed, you're fully awake. So this is just a suggestion. You can keep a utensil. The old people used to do it. When they had outhouse in the old days, they could keep a utensil under the bed. And they just use it and they empty it in the morning, so you don't have to go very far. You can actually slip out of bed. I may just warn you, I had a patient who used to keep his shoes under the bed as well. And one night in half sleep, half wake, he got up and he used his shoes instead of the utensil. So you might be mindful of that. But that is an option as well, so that you don't have to make the trip. The worst thing is you get up between sleep, wake, like has happened with me good many times. And you're going to, although I have a bathroom built in my bedroom, and you stump your toe in the bed, foot or something like that, well, boy, that is going to make sure that you stay awake for quite a while. All right, so that once you see you've gotten the sleep, okay, you come back to your bed. What you need to do, for those who are still having difficulty, you assume your most comfortable position. Like I like to sleep on my right side with a pillow between my knees. That's my comfortable position. You assume your most comfortable position. And then what you do, you bring your attention to your breath. It's a kind of meditation where whatever thoughts come in the mind, when you bring your attention to your breath, you'll notice the thoughts will disappear. And once you keep doing that, it's a question. You will find that you'll drop asleep without realizing it. So again, of course, sometimes there are psychological issues that are underpinning the insomnia. like I like to say, I tell friends, whenever you can't sleep in the night, it's because you bad talk somebody during the day. You understand? Or you're trying to get even with somebody, or you're holding something body in mind. You're carrying them, as we say. You're toting baggage, as we say in this country. So that there's also that component where you need to, make amends if you've done somebody wrong. You find at the earliest convenience, you go to them and you admit you're wrong and you ask to be forgiven. And more important, those people who offend you, it's important that you forgive them as well. Because Jason, when you go to pray, a lot of people say, you remember that line from the Lord's Prayer? Forgive us as we have forgiven those who trespass against us. In other words, I'm saying, God, you see how I forgive Jason? I want you to forgive me the same way. But if I didn't forgive you, Jason, I will not feel forgiven. My ability to feel forgiven is inversely proportional to my ability to forgive others. And once we are holding people in mind, once we are carrying resentment, it's like, if I were resenting you, it's like I give you free rent space in my head now. I'm going to sleep with you in my mind, and I'm waking up with you in my mind, and you're not even aware of it. You sleeping comfortably every night, and here I am, can't go to sleep because you are there. And sometimes it can be several other people, and not only people, it can be situations that we are carrying that we find untenable. So that usually, whenever we are disturbed, Jason, nothing is wrong with anybody else, Something is wrong with us. It is because we are finding someone, something, some situation of our life unacceptable. And we will have no peace of mind. We will have difficulty to sleep unless we accept that, look, Jason is Jason. I have to accept him as he is. Tom is the way he is. And that situation is the way it is supposed to be at this point in time. And if God could accept it and accept that person, why can't I? Besides, I am not doing them any harm. I am poisoning myself and expecting them to die. That is what I'm doing when I resent, because now I can't sleep. While you are sleeping comfortably, I'm waking all night. So there's a lot more that could be said about this. Of course, trying not to eat very late, because if your digestive system is going haywire, you'll have trouble to sleep. You understand? If a person is exercising, they will sleep better, because one of the functions of sleep is to give the body rest. So that if you get your body tired, you're going to sleep better, right? So that, again, please do not become dependent on any substance to put you to sleep. I know a lot of people even using herbal extracts and melatonin, and too much of that can be dangerous as well. So please don't go and self-medicate with alcohol and marijuana and any one of those things. Get back to a healthy lifestyle. Just remember, in fact, when I was president of the National Council on Alcoholism and Drug Addiction, I wrote a pamphlet for one of our Drug Awareness Week. And the banner of it was, healthy lifestyle, no side effects. Healthy lifestyle, no side effects. If you are eating the right foods, you are exercising, you are resting properly, and maintaining the right attitude to life, Jason, you will not need to take any medication. The only time you will probably need medical attention is if you are careless and get yourself into an accident. And I want to go back right to where we started from the video that was presented before, that some of you listeners will not have included. And that is to say, whenever we are unhappy or depressed or sad, it is basically because we are forgetting to be grateful. Because we first have to be alive to be unhappy, don't we? And I mean, what is more precious than life itself? And if we have life, we have more than enough to be grateful. So I want to let all our brothers and sisters know today, start your day from a position of gratitude. It is something that I practice myself as I become conscious in the morning. I start my day by saying a prayer of gratitude. I begin by thanking God for the opportunity of seeing another day. How many of our brothers and sisters went to sleep last night and didn't get up this morning? That we are fortunate to be spared because we have something to do today that God had intended for us to do. And we need to pray and ask God for guidance. So I ask God to show me the things He would like me to do and give me the strength to do it. So I'm grateful for the roof over my head, the bed I get up from, for the air that I breathe, the sunshine, birds, for you, for the program, for everything. And when we start our day from a place of gratitude, we start from a position of strength rather than starting the day with, oh gosh, I don't have this, I need to get that. Someone did me this, I need to get even. No, 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 no. That's not a good place to start your day. Start your day with a prayer of gratitude from all the things that you could be grateful for, and you are going to have a beautiful day today. I want to thank all our listeners, those of us who are listening live, and those of you who will be viewing the program. The day is the same every day. And every day you wake up, it's your opportunity to celebrate life and to be happy. And it is simple to be happy. It is simple to be happy, Jason. It's just difficult to be simple, you know. And let me end the program by saying, the time to be happy is now. The place to be happy is here. The way to be happy is to make others happy. And we have a little heaven down here. Thank you very much, Jason, for hosting me. And we look forward to you all again on next week, Thursday.
It's a pleasure to have you on the show. And of course, this was a very interesting topic. I know those tips that you give for sleeping is actually very, very, very helpful. I feel bad, though, for that person that went in his shoe. But what to take away from this show is that you made a really good point. Healthy lifestyle, no side effects. And of course, Mr. Dwarka is always ready and just a phone call away for all those that actually need help. So until next Thursday, I'm Jason Clue saying, see you around.